Have you ever taken a traditional taxi cab? Maybe you wanted to travel a different way, but you didn't have the option. Perhaps you've had a terrible experience with a cab driver that was rude to you, or you had a dirty back seat. Yet despite these issues, you took a cab anyway. This is the reality of hailing a cab. It never really is an enjoyable experience. But with the advent of ride-sharing apps like Uber and Lyft, traditional taxi companies were forced to compete for the public's business. Before, they could get away with a dirty cab or being rude to a customer because there was no alternative. They were the only game in town. Uber and Lyft changed all this by bringing real choice and competition into the marketplace, such that traditional taxi companies had to adapt or die. Some cities, like my hometown of Albany, New York, don't allow ride-sharing in order to protect the yellow cab companies. Instead, they're essentially propping up a monopoly by preventing choice and competition from entering into the marketplace. The same goes for the Affordable Care Act, Obamacare. Fortunately, if we repeal and replace the law by injecting real choice and competition into the healthcare system, companies will finally have to compete for your business. And it will be as though Uber and Lyft were introduced into your life for the very first time.
The best decisions on care for patients stem from the doctor-patient relationship. As doctors, we give our patients the best medical information possible so they can make the best decisions for their healthcare. However, patients are currently unable to view the cost of that healthcare because there is simply no way for them to make a decision on information that simply does not exist. Currently in the United States, there is no information available on healthcare institutions for them to make good decisions regarding their medical care. Anyone that really wants to make an informed healthcare decision based on cost really needs to have all the information of surrounding providers, such as hospitals, surgical centers, and urgent care centers. A competitive medical system that actually publishes price for medical care will allow consumers to decide on where they receive their medical care and not just how they receive it.
People make choices in all other areas of their lives. So why should healthcare be any different? If each of us was empowered with a health savings account, given the same tax treatment as big businesses get, and allowed to shop around in a marketplace just like Uber and Lyft and taxis for health insurance, pricing would be restored, costs would go down, quality would improve, and access would go up. Consumer choice and provider competition are the strongest motivators for change, and shoppers will go wherever they have to in order to get the best deal. Enough with the taxi cab healthcare. It's time for patient-driven care.
My name is Alex Ramirez. My newborn daughter recently arrived early and had to spend some extra time in the hospital. In situations like these, for young growing families like mine, it is absolutely crucial that we have access to quality healthcare at a competitive price. It is absolutely necessary that we repeal and replace the Affordable Care Act. If you agree, call your local representatives and senators today. Visit us online at millennialpolicycenter.org.